Good morning, everyone, and thanks for joining us today. And this session is part of our ongoing West Virginia Abroad Webinar Series. In these West Virginia Abroad webinars, what we're trying to do is highlight faculty perspectives and create a space for conversation around global and experiential learning across disciplines. That includes faculty-led study abroad, student and faculty exchange programs, COIL, collaborative online international learning. There's lots of ways that you can integrate international experiential education into a curriculum. So today's session is intentionally exploratory. Rather than presenting an established program, we'll be hearing reflections and the kinds of questions and opportunities and barriers that can arise at an early stage of thinking about global engagement within a discipline, in this case, social work. So as always, institutional procedures and processes vary by campus. So today's focus is on ideas, possibilities. It's a disciplinary reflection rather than a formal program development steps. Things that when faculty are in this exploratory mode, that they might identify the kinds of support that they need in order to move this beyond exploration. So I'm pleased to introduce Dr. Megan Gandy, Associate Professor and BSW Program Director in the School of Social Work at West Virginia University. Megan brings experience in clinical practice, advocacy, and social work education, and her work centers on student-centered and socially responsive approaches to teaching and learning. So Megan, thank you for being willing to share your experience and reflections with your colleagues around the state. And so I'm going to turn it over to you, Megan.
All right. Thank you so much, Clark. It was great to have your introduction, and it's really exciting to be here and share with all of you all the things that I learned about global learning during my recent trip to Iceland. So I did have the privilege of going to Iceland in November of last year. And so that's going to be the context under which I'm sharing the reflections that I'm going to share with you today. And so I'm also going to be drawing on some experience that I've had in another institution with global learning through a faculty-led experience, and just kind of helping you see how all these things have woven together for me. And my goal is to spark some interest, spark some ideas in you all as educators, especially social work educators. I think there's a lot to learn from international perspective. And so we're going to be thinking about professional identity as social workers, and also touch a little bit on accreditation and how global comparative learning can really fit well with our accreditation requirements. So let's get on to the next slide here. Can everybody see my slides okay? Give me a thumbs up if it's good, if you can see it.
I can see it.
Thank you, thank you. All righty, so the title is From West Virginia to the World, Faculty-Led Global Learning in Social Work Education. Or, if you ever watched Rocky and Bullwinkle as a kid, the cartoon, they always gave these cute little alternative titles. And so the alternative title is, or How to Accidentally Plan to Meet with Cool Social Work Collaborators from Another Country. So one thing you'll find out from me is that I like to bring humor into the work that I do. And so this is kind of my story of not really intending on setting out to do global learning, but having the wonderful opportunity to do so. And so I'm hoping that as easily as I was able to fall into this work, I'm hoping that I can inspire you all to do it, and maybe do it more intentionally than me. So that's kind of my goal there. And of course, I just want to thank the West Virginia Higher Education Policy Commission, Clark, of course, and Candace, as Clark said earlier, Candace was the one to connect the two of us when she learned that I was doing an international presentation on the work that she and I have been connected with. So also just want to give a shout out to my School of Social Work. They supported the travel, and I also would love to thank the University of Iceland, the Faculty of Social Work, Dr. Gudbjorg especially for meeting with me. And then, of course, the whole reason I went there was to present on an entirely different topic. And I just want to give a shout out to my team who was able to make that presentation happen. So Heather, Samantha, Jackie, and others. So the goals that I have for this webinar is I want us to just kind of touch for a minute on how global comparative learning can enhance social work education in West Virginia. And I'm going to give my experience as an example, and then we'll touch a little bit on accreditation and how something like this could really enhance your accreditation curriculum. And then the breakout work that we'll do will be you kind of thinking about your own institutional context and identifying some resources and getting some ideas generated. And so again, I'll reiterate what Clark said, that what this webinar isn't is sharing formal processes. There's a lot of really wonderful resources and support out there institutionally. So that will be for another webinar. This is more just me and my reflections on this process. So to get us started in thinking about global learning, I'm sure many of you probably share the same view, but what we think about when we hear global learning, sometimes people just think, oh, there's the cost, oh, there's a plane ticket, or, oh, we're going to go sightsee. But what I'd like to encourage everybody to do is think further into comparative thinking, because that's really where the deep learning can happen. And that's where we see an experiential learning opportunity coming into the student's experience. So it's not just about getting a chance to go somewhere. It's about thinking more deeply about the work and the content that they're learning here at WVU or at whatever institution you're at in West Virginia. So just a quick chat poll. I don't have a formal poll, but if you just want to drop in the chat, if you are in charge of a program or a faculty member in any kind of higher education program, do you currently engage in any global learning? And you can just drop in none, exploring, or already established. So just drop that in the chat if you don't mind. Let's see. So we've got one person that says they don't engage, one person who says they're established, another person says none. Somebody led a study abroad to last May to Scotland and Ireland. That's great. Great, thanks everybody. So we've got a kind of a broad array of different experiences and different kinds of knowledge about this topic. Again, I'm sure you all are here because you care about global learning. And so we know that global comparative learning really matters for our students in West Virginia. Number one, we know that it allows students to see the world under different policy circumstances. And policy literacy is something that we teach in social work education. And so it gives students the chance to really experience what it would be like to live under different policies. And then it also gives us a chance to position ourselves institutionally as having more innovative learning opportunities. So rather than just talking about the things or having students think critically about the differences across countries, we can actually have them experience that. And then one thing, especially in social work education, that we do is we want to prepare students to understand how different systems work and operate against each other, with each other, the kinds of factors that facilitate the work between systems and the kind of factors that are barriers to systems. And I think they do learn that when they go out into the field and do their internships. But one thing that's really powerful is when they can see and experience a different a different way of systems operating, and they can really understand the nuts and bolts of, okay, that system that operates and these things work well in that system, and then this is how we operate and this is how we do things. So it really just brings to life the systems thinking that our social work students need. And of course, all of this is in the context of West Virginia's unique characteristics of being highly rural. One thing that I know the West Virginia Higher Education Policy Commission is focused on is workforce development in order to address workforce shortages. And so if we're able to offer this kind of learning, then we can bolster the workforce through this work. And then we can also offer students a chance to think more about their own professional identity and think about what social work is and so what it means to be a social worker, what it means to be a social work student. And that becomes even more powerful when they look at other countries. And so launching into my experience, where did I start? I started by accident. And I say that because I think there's a lot of entry points into this work. And I think that there's probably a misconception that like, oh, I have to like really plan ahead and think so thoughtfully about this. And you do, there's no doubt about it that you do need to have a lot of planning, but you can begin to explore in a really accessible way. And that's kind of how I came to be presenting at this webinar, was that I was already going to Iceland, and I decided, hey, let's add on this additional context about exploring faculty-led student experiences. So, like I said, this didn't start with social work education or higher education necessarily. I was accepted to present at a conference that's hosted by the International Virtual Reality Healthcare Association. And so the thing that got me over there was entirely unrelated to social work education specifically, although not entirely, because the work actually does involve outreach about social work education. And so I took the opportunity to make connections while I was there. And that's kind of where the story goes from here. And so I figured, social work is in a lot of countries, and Iceland is one of them that it is in. And so I looked up where do they teach social work? Well, they teach it at the University of Iceland. And the University of Iceland actually has the only social work program in the entire country. And so that may sound a little interesting, but if you compare it to their population size of about 350,000 to 400,000, then you can understand that one program of social work probably meets their needs. So I just reached out to them and said, hey, I'm going to be in town. Does anybody want to meet up and talk? And so Dr. Gudbjorg Otto's daughter, I probably totally butchered her name, she agreed to meet with me, and we met in this coffee shop, and we just had a wonderful conversation about all sorts of things, about our own research, about things going on in the different countries. And then we spent a lot of time talking about social work education. And that's really where it really became clear to me that a faculty-led student experience could be really rich. And so in sharing this is kind of the point that I want to drive home. My approach was very informal and very relational. I wasn't setting out to say, hey, I want to establish a study abroad with you all. My point was to say, let me build relationships here. And then let's see what can come out of this that could be mutually beneficial. I think that's one thing that's really important when we talk about global learning and study abroad, is ways to not just have an extractive experience, but to have things that are mutually beneficial to all parties. And so in our conversation, I just kind of focused on that comparative thinking. What's similar between our different contexts? What's different? And then getting a bit more underneath that is what are our assumptions that drive our systems, especially around social work practice, but also social work education. Oh, and also because I think any talk about global learning has to have pictures involved. I have dropped in pictures of my trip that are on each slide. So there's no correlation between the picture and the content on the slide. I just wanted to share some pictures with you. So you'll see the little descriptions of them down there. But this one is one good example of some great student learning that could happen. We do bring students to the Capitol here in West Virginia for policy learning. And so we could also do that same thing in Iceland. That's their Parliament House there in Reykjavik. So kind of just off the bat, what I learned from my conversation with Gudborg is that I learned a lot about Iceland's welfare system, and not just the nuts and bolts of it, but how it actually works in reality. And that really kind of opened my eyes to the realities of kind of seeing, Iceland is has a very strong welfare, Nordic welfare model, and they have a lot of funding for social services and social work. But, as everything is, there's more to it than what meets the eye. And so it was really illustrative to understand the real challenges that they face under that system. And so I learned about their system of social support. We talked a lot about social work education and the entry into the profession out once they graduate, and how the regulations differ between our contexts. And then one thing that we talked a lot about was workforce shortages, and how do you get young people interested in doing this work so that they can start their career in their college experience, and then build from there once they get their degree. And one thing I'm just really grateful for is just how deeply generous they all were. Dr. Gudborg in particular, but everyone there that I met was incredibly generous in sharing all of this information with me. And so I just want to kind of share some of the things that I learned that were surprising to me, and hopefully through that we'll give you some illustration on how deep and just how much there is to learn if we do global comparative learning. And so I just kind of outlined some similarities between Iceland and West Virginia. I know that West Virginia is a state within the country of the United States of America, and Iceland is its own nation. But there are a lot of helpful things to dwell on here. So we really kind of started out just thinking about the size and geographic location of both of our spaces. And so number one, here in West Virginia and in Iceland, we're both fairly small in comparison to other contexts around us. West Virginia is a smaller state and Iceland is a smaller country. And then also the geographic isolation. I think that one was really key because I think here in West Virginia, one of the factors that influences our challenges in social work is just how geographically isolated everyone is, both between each other and outside of West Virginia. And so Iceland also experiences that as an island nation. One of the other similarities is that we both share a great deal of natural beauty, and with that natural beauty comes a lot of tourism. And so we do tend to have a lot of visitors. I think Iceland probably has more visitors than West Virginia, but there's a lot to say about this culture of welcoming other people and really getting them to love and appreciate your space for the beauty that it has. There were also some very striking social pressures that were very similar. Like I said, workforce shortages. And so just like we are experiencing workforce shortages here in social work, they also are experiencing that in Iceland and across Europe. Actually, I learned that through some other conversations as well, just that the work that we do as social workers is there's a lot of misconceptions about it. There's a lot of stereotypes about social workers and social work practice. And so in the same way that those influence young people's decision on whether or not to get a social work degree, that influences them similarly to how it influences us. And so then in terms of social work practice, there were also a lot of similarities, especially around youth mental health and the rate of suicide that's very concerning among youth. And so that was one of their practice focuses, as well as substance use disorders. Unfortunately, another similarity that we have, that there's a greater need to treat and address substance use disorders. And there's also the intimate partner violence issues that can happen. Those are also something that is a shared similarity in terms of practice. And then there's also actually a good number of cultural tensions that we share in similarities. And so what I didn't realize was that Iceland was very, I realized that it was very homogenous, but it was also very racially homogenous up until around the early 2000s, when they really, as a country, opened and pushed for being open to visitors and having a focus on having outsiders outside of their island come in and be a part of the country. And that was a very intentional shift for the country. And so what that meant is that migration changed very rapidly. And as a result, there were more racially and ethnic diverse people there than ever before. And so unfortunately, along with that came a good amount of racism and some xenophobia, just around differences and people not appreciating differences in the way that we would hope that they would, but having stereotypes and prejudices on the interpersonal level. And so unfortunately, that's something that we also share here. There is a lot of isolation and a lot of racial homogeny here in the state that make it very difficult when it comes to accepting other cultures or recognizing the prejudices that we do carry. And so those were cultural tensions that were shared amongst West Virginia and Iceland. And then there's also, unfortunately, shared similarities in the cultural response to supporting gender affirming care for transgender and gender diverse youth. And so unfortunately, we face a lot of challenges in that practice area here in West Virginia, and that is also something that is becoming more challenging in Iceland and across Europe. And so that's actually one area of social work practice that I focus on is LGBTQ plus well-being. And so I think a lot of times in my work in LGBTQ plus social work research, I tend to think of Europe as a safer place for LGBTQ folks. And so it was disheartening to hear that some of the same challenges that we face here in terms of policy and restricting access to care, those are things that they are experiencing there in Iceland as well. And then lastly, just the rapid demographic shifts. Like I mentioned with Iceland, they had been fairly homogenous and the demographics have shifted. And I think for us here in West Virginia, we do see a demographic shift, but that is that our population is growing older while our younger people are exiting the state more frequently than we would maybe like. And that's just resulting in a pretty stark demographic shift for us. So that's another thing that we shared. So then thinking about the differences between our countries, again, Iceland has this Nordic welfare model, and we know that that comes with a lot of blanket supports for people when it comes to social services and social needs. There's things like the universal health coverage that takes away the barriers that we have here in terms of accessing healthcare. However, one interesting thing that I learned about was that the local municipalities, at least in Iceland, they are given the latitude to decide how they implement various health programs, public health, access, social work programs. And so you see a decent amount of variation from municipality to municipality. And that's purposeful so that each municipality can focus on their own population's needs that might be different, say in Reykjavik, which is very populated, versus some parts of the country that are very rural and isolated. And so as we know our system here very well, the United States welfare system, the social services and benefits that people can access are eligibility based. And so whether it's an income level and having a poverty level that people have to meet, or having other criteria like their family composition, most often we're using eligibility based criteria. And that goes for older adults as well. In terms of accessing Medicare, you can't access it until you reach a certain age, or you have a disability and things like that. And so in that differential comparison, we see that whereas Iceland has this single funding stream of universal coverage, we are getting funding from multiple different streams. Some of it is the state, some of it is the federal, some of it is charitable. And so that becomes more fragmented when we think about funding. And therefore, we also see a lot of differences on the county level. So similar to their municipalities being different, we see a lot of differences by county and sometimes by region. Another thing that was really interesting was the professional regulation differences. So I learned that Iceland does not have a license process for their social workers. They just simply graduate, not simply, they graduate and then they register, and then they are a registered social worker. So they don't have a licensure exam, and they don't have any clinical distinction in terms of a clinical licensure. And that, of course, differs here because we do have our licensure exam and all of the requirements for clinical licensure especially, but we do operate under a licensed social work model. And another interesting difference was the cultural difference around volunteerism. So I learned that in Iceland, because, well, there's probably many factors, but it was shared with me that because the welfare model is universal, there can be a tendency to view social well-being or social services as like, that's somebody else's job. Like, that is the job of the state. I don't need to help other people in a volunteer way because they can just go to the state for help. And so it was shared with me that they sometimes have a hard time finding people to volunteer and to do volunteer work, whether that's just for the sake of citizen participation in their region, or if it is social work learning in particular. We do have students volunteer to learn about how it is to be of service to other people. And so they shared that they really see us and the amount of volunteerism that we have in our country to be admirable, and they said that they wish that their students would do more volunteering. And of course, we know that the reality is often very can be varied, and I think there's different people that embrace volunteerism here in our country more than others. But it is true that we do have a stronger volunteerism culture, and especially in West Virginia, where we have mutual aid as something that is really embedded in our culture. And we also have, because of our fragmented funding, we do have more charitable organizations. And so a lot of people end up doing volunteering through those charitable organizations. And so shifting now to what I was thinking. So that was like this 2 or 3 hour conversation where I just learned all of that. And it was really, really powerful for me just to see just how much I learned in that short amount of time. And so then I started to kind of think, stepping back and thinking like, oh, well, you know, there's a good opportunity here for students to learn a lot about this too. And I thought back to my experience 10 years ago with a different university. I was able to chaperone a faculty-led student exchange to Israel. And so the focus was on child welfare in that trip. And it was a small, reasonable cohort of students, but I was able to chaperone because they needed a certain faculty to student ratio. And so, that experience for me was really transformative, and it was transformative for the students as well. The students really engaged much more deeply with child welfare policy and the child welfare system. And they also were really struck by the similarities in how our countries handled child welfare. And so that experience for me really showed how powerful this global learning can be. And within that experience, we were able to host reciprocally and have Israeli students come over and learn about our systems. And that was a really special thing because the students started building relationships during the trip from US to Israel, and then they were able to pick up on those relationships and build those more on the trip from Israel to the United States. And so the things that I learned in that experience, policy really becomes tangible. Students can really see different systems in action and really understand. And that's the deep learning that can happen with experiential learning, is that we know that students can really see things playing out in real life, and that is a really powerful way for them to learn. They also really see that there are a lot of similarities across international contexts, and it's really powerful for them to feel a sense of global community and global connectedness when they realize just how much we have in common with each other. And then I would be very interested in a reciprocal hosting experience, because I think that really deepened and extended the learning for the students. And then it also helped the students really shape their professional identity. So realizing what does it take to be a social worker in Israel in this experience, or in Iceland, or in other countries, that really helps them understand how we shape their professional identity here, and what's universal across all social workers across the globe versus what's unique to us here in the States. And so just so many opportunities for learning come about from that. And so just a brief touch on the accreditation that we do as social worker educators. This will be more helpful specifically for those that have accreditation driving their degree programs. So we know that our accreditation doesn't require any kind of international travel, of course, but this kind of global learning can really enhance and achieve competencies, and some specific competencies in our accreditation. So in our EPAS, or Educational Policy Accreditation Standards, there's 3 different competencies in particular that global learning could fit really well within, and it's actually mentioned in 2 of them. So of course, competency 2, having a focus on human rights and justice. There's just a plethora of examples of how the students can learn competency in human rights and justice through global comparative learning. And then competencies 3 and 5 do actually mention a global context. Competency 3 being focus on anti-racism, diversity, equity, and inclusion. That is specifically mentioning how global contexts and global interconnections impact ADEI. And then competency 5 around policy practice. Of course, policy has been interwoven throughout this whole presentation. So we definitely know that there's a lot of implications for that. And then, like I mentioned, so part of our accreditation and our curriculum standards requires us to socialize students to the profession of social work. And so I've already kind of shared some of the details about how we could do that with global comparative learning.